With a relentless focus on excellence in healthcare, Pullman Regional Hospital presents the Health Podcast.
Immunizations are considered one of the greatest public health achievements of the 20th century, but there are still segments of the population that skip regular vaccinations and don't understand how important they are. Here to talk with us about why immunizations are a good idea for your overall health is Dr. Stephanie Fosback, an internist with Pullman Regional Hospital. Dr. Fosback, thanks for your time. So why is it important to get immunizations at any age?
As we age, we get different exposures and we have different risks related to those exposures and also different risks related to certain illnesses. When we're young, we have high risk from childhood illnesses, things like measles and mumps and rubella, Haemophilus influenza can be life-threatening for our children, and we are very fortunate to live in a time, or I feel very fortunate to live in a time where my children are protected by vaccines. And then as we age, things like pneumonia and shingles can impact us more and more. And I think it's very important if we can prevent those illnesses, prevent not only how ill those illnesses can make us, for example, flu, but also prevent things like chronic pain from shingles is very important.
Well, thank you for sharing those with us, Dr. Fosback. And you said something interesting there. Sometimes vaccinations are for short-term and some are for long-term. Is it the long-term vaccinations that people seem to miss or forget about or just kind of put off?
You know, most of my patients don't put their vaccines off because most of my patients that I care for come from generations where they've seen things like measles and mumps and polio. So most of my patients don't put off their vaccines, and most of them do recognize the importance of vaccination. I think we all have a tendency to forget the severity of some of these illnesses, especially those of us who've been fortunate enough to live in a time where we didn't have a lot of these childhood illnesses and we didn't have exposure and death related to them. So I think people put it off partially because they fear the vaccines more than they fear the illnesses, which is unfortunate. And the vaccines are incredibly safe, and we need to get them both for short-term benefit and for long-term benefit.
Well, that makes sense. And it is a shame if someone is more concerned about the initial shot than the good that vaccination can do for them. So let me ask you this then. How does your history of childhood vaccines impact your need to get vaccinations as an adult?
So that's a tough question because it very much depends on the patient. If someone was never vaccinated for childhood illnesses, we do recommend that they get vaccinated, but for which illnesses depends a lot on their health history.
Okay, and how about booster shots then? What about those, and when would somebody need them?
So again, it depends on the vaccine. Let's talk about tetanus boosters, because I think that's what people think the most about. Tetanus boosters should be given about every 10 years, and that's because our immunity, what our body builds up to fight infection, sort of decreases or wanes over time. So when we're young, if we are exposed to the chickenpox virus, which most of us were up until there is now a chickenpox vaccine that children receive, we are at risk of developing a painful rash called shingles. That virus lives in our body our entire lives. And it can reactivate as a shingles virus. The shingles vaccine can help reduce our risk of getting shingles by a significant amount. And there's a new shingles vaccine that's much more effective and much safer than the previous shingles vaccine. It's 2 shots, 2 to 6 months apart, and it's recommended for all individuals who are 50 and over. And people should ask their doctor if they have immune conditions that might make them higher risk for the vaccine, but for the most part, it's recommended for all individuals over 50.
And Dr. Fosback, are there other common vaccinations that adults ignore or just don't know about? And what are the most important vaccinations people should consider as they age?
So I would say every year getting a flu shot, making sure your tetanus vaccine is up to date. One thing that I hear a lot is in my practice is that flu shots cause the flu. That's a myth that I hear a lot. Certainly, somebody a low grade temperature, an achy arm, or they can feel a little bit of malaise for a few days, but that's not the same thing as getting influenza. Influenza or the flu can cause several weeks of muscle aches, high fever, life-threatening respiratory illness. And so definitely, if the flu shot is accurate, and that's always a guess from our wonderful Center for Disease Control, but if the flu shot is accurate, or even if it offers some protection, it's better and safer than getting influenza. Certainly the shingles vaccine, as we mentioned, probably the most important vaccine for individuals, everybody who's over 65 and other individuals with other conditions like lung conditions or conditions that impair their immune system should be getting what's called the pneumococcal vaccine. And there's 2 of those to help prevent severity and illness related to pneumococcal pneumonia. And then if people haven't had their hepatitis A and B vaccine and they have exposure risk to those vaccines, they should also get those.
And wrapping it up for us, Dr. Fosback, is there any other thing we should know about vaccinations?
There aren't many things in medicine that haven't changed over, 100 years. And vaccines really haven't changed. And so they're safe. They've been around for a long time. And I want people to know that their doctors and the Center for Disease Control and we have everybody's best interest in mind. The entire community will do better. Our entire world will do better if we all get our vaccines as recommended.
So true. Well, Dr. Fosback, thank you so much for your time today. We appreciate it. For more information, visit pullmanregional.org. That's pullmanregional.org. This is the Health Podcast from Pullman Regional. I'm Bill Klaproth. Thanks for listening.